So we're starting our shows with reviews of some of the gadgets I buy. I buy quite a few gadgets. This is one of the gadgets that I always talk about. Helps with meditation, sleep, just relaxing. It's the Brain Tap. So it's got these headphones, but then it's got this visor that has light, and even in the headphones, I'll turn it on so you can see it. It's got these lights and pretty much uses light and frequency to get you in a relaxed state or meditative state. I use it like almost every night to go to sleep. I even take it on flights, and it can put you in a nice relaxed state. Even if you have trouble sleeping on flights and stuff, it could kind of relax you and get you to the right point. And it's got tons of audio selections that you can choose from the app, that whether you want to use it to focus, to sleep, for performance. It's got all these different apps, and even for kids, like kids can use it, to get more focused on doing their homework or just more relaxed before they go to sleep. So it's a great tool. I use it almost every night. The first set I got two of them, so I gave it to my brother. My brother doesn't use it that much, but I heavily believe in it. It's just, I find like I see my deep sleep getting much better, especially when I put this on with some of the different tones. And we'll move on to our guest. It's Delonte Marshall, yes. With what, Balanced Organics?
BioBalanced Organics.
Okay, BioBalanced Organics. And just tell us a little bit about yourself, what you do.
Well, I'm an herbalist here in Phoenix, Arizona. I've been working with herbs and plants for about 12 years now. I own 2 apothecaries here where I make herbal extracts and medicine. Well, not medicine, excuse me for that. I'm not a doctor or a pharmacist, but herbal remedies, if you will, and just ways to assist individuals in increasing their self to optimal health. I'm currently studying at the Notre Dame for clinical herbal medicine for my Master's of Science, and I'm just excited to see where the world takes me in regards to plant medicines and how we can interact with science and make the cross and intersection between that.
Yeah, there's a lot of it coming back, right, with like the herbs and everything. For me, I'm Persian, and I see a lot of the stuff that, like, when I was growing up in Iran and stuff, it was like, pomegranates, berberries, stuff coming back. So a lot, and like more and more herbs are being studied these days.
Yeah, I know like quite a few countries specifically use herbs in their medical practices, especially Europe. They have a lot of herbs within their Materia Medica that they utilize, more importantly for like hormone production, male support, even with regards to digestion and things like that.
Yeah, and what people like think supplements, a lot of those supplements have like some sort of herbs and stuff in there, but they're probably not getting the highest quality, but you're probably providing better quality and just herbs instead of just like,
fillers
some
and binders.
Compound.
I'd say I'm providing really good quality herbs to individuals. I have quite a few farmers that I work with that I get my plants directly from. And genuinely, the formulations that we utilize pretty much interact with or behave as certain meds would, due to the fact that they do standardize some of those plants to make it.
What are some of your like most common herbs that you
people
guys
use?
Yeah.
Ashwagandha, which is also known as Withania somnifera. That one is considered an adaptogen herb, but it also can act as an anxiolytic.
Yes.
Again, this is not medical advice, so I'm just saying that is one of the benefits that it has been studied to do. It helps to relax the central nervous system. You can also check with nettle leaf and nettle root, which is Urtica deica. That plant specifically helps to remineralize the body, provides lots and lots of iron. It also produces retinol and vitamin A. So it assists with like skin conditions, tightening the skin if you have issues with like collagen. Yeah. It's a lot of herbs that you can utilize. There's plenty of them.
With the nettle, are you form it into a cream, or how's that?
Well, it depends on the person or the need for it. So there are some plants that I do formulate into a cream because it can only be used topically, and there are some that you can take as a tea, an extract, if you will, a tonic. And the nettle itself can be used topically, especially if you make it into a powder. You could use it as a face mask.
Yeah.
And taken internally, it gives you a lot of very beneficial minerals.
Yeah, ashwagandha you see almost everywhere nowadays, especially like, as people are moving towards non-alcoholic drinks and stuff, it seems like it's in all those adaptogen drinks.
It would make sense though, because it does help to stimulate the adrenal glands.
Yes.
So it kind of gives people this similar experience that they would get from drinking, similar to kava. That one does the same thing. It's a lot of new, I guess you could say, supplements that do utilize plants or some form of the plant in order to get the benefits that people would need.
What do you think is one of your top ones that you're excited about?
As far as my blends?
Yeah.
Ooh. Well,
let's go with let's start with like sexual health. What's good for
so with regards to sexual health, Damiana is also known as like Ternera diffusa. They use it a lot in like Native American cultures. It is considered an aphrodisiac, but its job is to provide like oxygen directly to the genital region for both men and women. Slippery elm is also known as like Almus rubra. That one is good for producing more moisture to the vaginal canal, well, overall the mucosa of the body. So that one helps to maintain the moisture and sustain the pink parts, if you will. Also, horny goatweed is another one that is really good for men. Yeah. It helps to actually, again, provide oxygen, but it increases the firmness of an erection.
Okay. And how are they taking these as teas or?
Well, for me, most of the time I say
formulation for like sexual.
Oh, I usually make formulations specifically, although one herb itself is good, but usually when you pair it, you get a better benefit from each individual herb to pretty much interact with the different organs, if you will.
Okay. All right. And how long before are people taking this before like having sex?
Well, it depends on the person. I've had quite a few guys that
just always take it.
Yeah, but I've had a few guys who were one guy, he actually had an implant, and he couldn't sustain a firm erection. He taken it about an hour before and called me the next day singing James Brown tunes. Yeah. So there's quite a few. It depends on the individual, I'll say. I can't give a specific, but for the most part, people start to get a good experience within the first 24 to 72 hours.
Okay. And then like right now, we're in winter season, which is like flu season, stuff's going around. How about immunity? What do you usually suggest with immunity blend?
So we do have an immunity tea that we make in our shop that uses astragalus or astragalus membranaceus. That herb specifically helps to increase white blood cell count. Yeah. And then we try to focus on helping the liver enzymes to make sure that the liver is actually producing the red blood cells and ensuring that it is breaking down different sugars and cholesterol so we can impact immunity quicker.
Okay. And what made you get into this altogether?
Oh, I used to suffer from migraines, like so bad to the point where I had gotten a spinal tap. I was prescribed a plethora of medications, even for different digestive conditions, MRIs, and none of it worked. It was like I would take my meds, fall asleep, wake up with the same migraine or worse. Yeah. And honestly, I prayed. Yeah. And this was 2013, I believe it was. I prayed so hard, and God just start like dropping random gems about herbs into my lap. And that's when I found out how they formulate, if you will, Percocet, using different plant extracts. And from there, it was like a rabbit hole. Yeah. And I love it. All right. Everything about it.
Yeah, it's kind of like how I got into like peptide and the whole wellness and biohacking stuff. Is like, you just like get little droplets, and like now I run it in my practice itself. It's not just we do plastic surgery, but also the wellness and like hormone treatments and all that stuff. It kind of just gives you little areas. You're like,
that's pretty good.
Fun. Yeah.
So can I ask a question to you?
Yes.
So in your practice, when you utilize the peptides, are you using that as a course of action after the surgery or before, during?
All sorts of it. There's some patients that come in for, they want improved energy, muscle mass, or weight loss itself, or we use post-operatively, we use it for recovery. We use the different things. We use the Wolverine stack, as it's called, which is BPC and thymosin beta. And they start taking that almost before they even have surgery. So, and some of the GLP-1s and stuff we use for them to lose weight so they're able to have the surgery. So they get overall, they build that health and continue going on forward with it instead of just operating and, hoping for the best.
I believe you because I know some of your patients. So.
Yeah.
And they actually still take good care of themselves. And they're great.
Yeah. It's so important to, I spend much more time with the patients now. Before it was like, just you talk to them about surgery and that was it. But like, it's about developing that post-op care package that they know to take care of themselves and someone's there taking care of them instead of just like, you can go online and just like we did, we got into a rabbit hole, but they actually get it from someone that's already done the research and can give them the best ideas. And, there's plenty of journal articles and stuff that we have access to that nowadays almost anyone can get access to it.
Oh yeah.
Yeah. But you can pick out what's good
research,
and not.
Though.
Yeah. Yeah.
You have to know what's right and authoritative. So
yeah. What area are you most interested in the botanical?
Oh, I'm most interested in formulations. Like I love the concept of pairing the plants together and like the best ways each plant interact with each other and different organs.
Yes.
It kind of gives me like a bit of excitement when I can see two different plants that does the similar actions but also does different actions at the same time.
Yeah.
It's pretty cool to see.
Yeah, there was I was listening to a talk from the Longevity Fest and I forget what herb they were talking about, but they were talking about it pretty much like acts like a GLP-1 or like when you're trying to get patients off of GLP-1s, they were using it to, it was pretty much mitigating. If it comes to my mind, I'll bring it up. I'll see if you know anything about it. And it's also for people that, it decreases appetite and probably increases your production of the GLP-1. So it's helped with weight loss. It doesn't, I don't think overall it wasn't convincing to me that you're gonna get the weight loss like you do with some of those medications, but it could be used as a tool to help people that are on GLP-1s that are having a tough time losing weight. So we take liver cleansing quite seriously, especially when patients have surgery and post-operatively to cleanse their system. What are some of the blends that would help with that?
We actually have a blend currently that we use a lot that has helped with, I'm not going to name conditions, but it's gotten a good result from our clientele. And it's called our Liver Life Tea. Okay. It has herb in it, Silybum marianum, which is milk thistle. Yeah. That one directly interacts with the liver. It specifically helps it to produce the glutathione once you start taking in carbs. Yeah. And overall, the blend uses a few herbs that not only help with the liver function, but they again work with hormone balancing, ensuring that the thyroid hormones are being properly produced, and also with synthesizing like triglycerides. Yeah. So a few herbs to name a few would be barberry, which directly helps with digestion and bowel production. You can also check with red clover, which is a trifolium praetens. That one uses it cleanses the blood, but it also helps to interact directly with the liver and restore those enzymes. And overall, you really don't want to strip the liver. You just want to help it do its natural restorative processes. So
clear it out.
A lot of time people take a bunch of astringents because they're like, oh, I want to restore the liver, but it's like you want to give it something to assist, not push it through.
Okay. Yeah. How about red yeast extract? What's that good for? Do you use that at all?
No, I don't use red rice
Yeah.
yeast extract, but I have had a few people who do take it as a supplement.
Yeah.
It can be good for the liver. It kind of breaks down some fatty cells in the body.
Yeah.
And overall helps the kidneys with its process of flushing. But I've not used it personally. I stick to like whole plants if I can.
Okay. And like I use dandelion root like as an alternative to diuretics. What else could that be used for?
Oh, dandelion is actually really, really good for potassium levels, so it helps with the heart. It ensures the relaxation of muscles so you don't get cramps. It is a mild diuretic, but since it has so much potassium in it, you have a low chance of becoming dehydrated from it.
Yeah.
It also can be used for the liver.
Yeah.
I use it also in one of the blends that we make for lactation, because it is pretty safe for individuals to consume. It doesn't have high contraindications.
Okay. And how do you, like, when patients come in, how can you check, or is there a way to check if they have like drug interactions or like, or if patients come in with certain conditions, you're like, definitely can't,
So usually if you are someone who does like the proper research, a lot of the plants in their monographs that are in plenty of government archives, they do give you information on different pharmacologies with regards to the interactions, contraindications of drugs. And then I also studied anatomy in my undergraduate degree. So I kind of ask questions like, what medications are you taking? Are you are you having certain surgeries recently or planning to have a surgery? So that way I personally can make sure that I'm not giving them something that they shouldn't take that will thin the blood or that would interact with certain heart medications that they're consuming as well.
Okay. And then how about like garlic? Any types of garlic that you use in your I know it's not an herb, but
no, garlic is pretty good for lowering blood pressure.
Yeah.
But garlic is also something that can lead to ulcers. Okay. So a lot of times you want to balance the benefits of something with is not being so beneficial. Personally, I say if it's something that you have in your cabinet and you have to get use out of it, go for it. But there are other herbs way better than garlic.
Yeah. Okay.
Or plants.
Yeah. How about actually brain health's a big one that I work on, or for myself, like always trying to improve brain health. What are some things that can help with that? Whether focus or memory.
Okay, well, regards to focus and memory, there's a plant called ginkgo biloba.
Yes.
That one actually provides oxygen to the brain naturally, and it has been studied with regards to like dementia and Alzheimer's, and it's said, not my quote, but said to reduce the potential for onset dementia and Alzheimer's. Yeah. Also, the hawthorn plant itself also does the same thing. It strengthens the muscles, including the heart muscle. So, first focus, you can do Melissa officinalis or lemon balm. Yeah. That one's really good for focus. California poppy is good for focus. Catnip is really good for focus, especially for children. Yeah. And you compare those together to give you like a really good powerhouse for like the overall system.
Okay. So what do you do for fun other than herbs?
Well, I play softball. Yeah. I play softball every Sunday, and I travel a lot for it. I've been to probably 16 states in 2025, and I already got like 4 more knocking off my list this month. But I play softball a lot. I love to go hiking. I do travel pretty much all the time for that. I hang out with my friends, my sister and my mom a lot. If I'm not with them or playing softball, I'm at home. Okay. Yeah, I don't go. I'm pretty much just an introvert outside of that.
Yeah, I'm always with my kids. Those were the younger days. I'm happy to be done with them, kind of. But the other thing, like with sourcing the herbs and stuff, you said you go to certain places that are that you trust. Mm-hmm. And are these coming from inside the U.S. or are they coming from other countries? Where do they seem to be popular?
90% of my herbs are within the U.S., so they're domestically grown. Yeah. I have 2 farmers in Colorado, one in Oregon. California, a few here in Arizona that I work with directly, all throughout the East and South, Midwest of the United States. Then I have a farmer in Malawi. I haven't gotten a chance to go there because I procured them during COVID, so it's kind of stuck. And I have also a farmer that I work with in Sri Lanka who I FaceTime and I watch them dry some of my soursop leaves and my blue lotus and stuff. But I have a lot that I interact with specifically in the U.S. and I love it because I don't have to worry about.
And are there certain ones that are specific to Arizona? Some herbs that are more specific to this area, or?
Oh yeah, mullein. We grow that in all the mountainous regions. You can go to Tucson and pick your own mullein, up to Prescott and Payson and pick that. We grow dandelion naturally, all the nettles.
And what's mullein good?
Oh, respiratory health. So that is a herb that a lot of people use for respiratory conditions. They call it nature's toilet paper because it's super soft, but it is kind of an expectorant, but it's not super rough on the lungs.
Like you get Mucinex, that this is going to be much better. Much better.
That and horehound, those grow in all the mountain areas.
Okay. Let's talk about male menopause, what it is and what supplements and
that is considered what andropause, right?
Yeah.
And isn't that due to high dihydrotestosterone levels? Yeah. A lot of times men experience that once they get to about 40. You start to get
midlife crisis.
Yeah, we start to go through a midlife crisis. Yeah. And the crazy thing is the symptoms of it are pretty similar to what a woman would get when they go through menopause, as far as like mood swings. A lot of men go through hair loss. Their livers start to not function as it should, weight gain. But some herbs that are good for that would be saw palmetto is a good one for it. Yeah. Again, the herb that I mentioned earlier, damiana, parsley root. You want plants that help to interact with the prostate.
And are these decreasing DHT or are they increasing your testosterone?
They're actually helping to balance those and assisting the body in using the hormones properly. Okay. So it's not necessarily decreasing, if you will, but it will help to balance it.
And if people are on hormone replacement therapy, is there anything specific you help them so that, to balance out their testosterone, where if they're overdoing it, instead of taking like an anastrozole or tamoxifen to lower their estrogen?
For that one, I would probably give them like ardonquois, which is angelica. Yeah. That helps the body to properly use and replace different male and female hormones. Okay. And then again, I would go with like maybe a prostate support. That way we can ensure that the body is producing the proper hormones as far as the men will go. And I've actually gotten some pretty good results with that as well.
Okay. And how about on the female side? How about like to help with PMS and stuff?
Oh, for PMS, a really good one is red clover. Overall, that one produces like really high isoflavones, which are like the phytoestrogens. Yes. Even more than soy produces. And that's one herb you can just give to a woman and she like start to get the benefits of it really quickly. Again, donquois is another one. It'll help her to utilize those hormones. And with regards to PMS, Vitex or chaseberry is another good one. Yeah. Now, if we go to like the pain management side of it, you want to go with something like cramp bark, or maybe, depending on the person, you can give them a valerian, but some people get anxiety from it, so you want to be very careful with that.
Okay. And are you seeing, more and more with, because we're discussing this today, because fertility is becoming more of an issue, not just in the female population, but they're saying like the men are almost catching up with the females in that realm. Is there like anything? I know when I was going through it with my wife and we went through IVF and stuff, I take these supplements, and it was probably like looking at the list, it was mainly a list of like 10, 20 different herbs. That's what it seemed like. Yeah.
There's a lot of herbs.
Yeah.
But for men, the best plant for that would be maca or Lepidia mayene. It's a ginseng from Peru. Yeah. That plant is really good because it helps to coat the sperm cell, and it increases its efficacy while swimming through the vaginal canal. Especially since, I'm not sure if everybody knows, but the vagina is acidic and the sperms are alkaline, so they really don't like to interact with each other. But Lepidia mayene is a perfect herb for that. with regards to ensuring that your swimmers are strong. And for women, you want to go with like false unicorn. That's very difficult to get nowadays, though. And also,
Why is that?
because it works.
Yeah.
Yeah. IVF will be non-existent. But it's good stuff.
Yeah.
And you just want to ensure that you assist, for women, you want to make sure that you assist them with, sorry about that. That's my business phone. You want to assist them with ensuring that they are properly balancing and managing their hormones. So usually I would give someone who's looking to conceive a hormone blend, as well as something that assists with restructuring the follicles.
Okay. And how about like in the realm of when we're talking about longevity and people come in for anti-aging or like longevity, or is there anything that, or any of the blends or anything that you see better than others?
Yeah, there are quite a few herbs that are better than others, but with regards to longevity, a lot of times you want herbs that help with antioxidant processes, so that way we can make sure that we're reducing free radicals in the system.
Yeah.
And soursop itself is a really good plant to help with that. It pretty much acts like a chemo, but it reduces cellular interference and helps to pretty much expel those.
Okay. And then how about like do you do anything with like mitochondrial health? Is that's becoming bigger and bigger?
I haven't specifically done anything with mitochondrial health, but there are a lot of plants that help with like intracellular absorption of different minerals like selenium and magnesium. So personally, I haven't done anything, but I'm sure if it comes up that I'll know what herbs to get someone.
How about like anything in the growth hormone, increasing growth hormone levels, or?
Oh yeah, alfalfa. That they even get out to horses to help increase horses' muscle mass. That's a really, really good plant. And then Tanga Ali is another one that you can give someone to assist them with increasing like muscle mass because it provides more oxygen, including cordyceps mushroom.
Okay.
That's very expensive if a person wants to buy it by the pound, but it is really good for increasing oxygenation to the entire system, and it gives you like a longer lasting stamina for you to work out.
Okay. Yeah, the cordyceps are also used for brain health, right?
Yeah.
Yeah. All right. And then Tonkat Ali, I think it was on like when it got on Huberman, like everyone's asking for that for the testosterone benefits. Although does it affect the testosterone that much?
No.
That because a lot of the herbs and stuff like with from the studies I've looked at, like seem to not do much. Like most of the people these days, with how bad like their levels are, it's almost like they need, actual testosterone rather than.
Pretty much, it's like diet plays a huge part in that. Exercise plays a huge part in that. If you're not doing leg workouts and lifting with the legs a lot, you're not increasing testosterone levels. I don't think that there's any particular plant that specifically focuses on testosterone itself, but it focuses on inflammation within like the male reproductive regions to assist us with that.
Yeah, and that's the biggest part. It's with the American diet, it's it's all inflammatory, right? And it kind of. I had like, I'm usually pretty clean, but like, I think during the holidays or something, you hit that inflammatory path where everything aches. So, I start taking my peptides again to kind of reduce everything. It was like aches and pains almost everywhere.
And then you got to think about the fact that stress is also inflammatory, right? So some people are dealing with daily stressors that they probably have never stopped dealing with. So they aren't even producing proper hormones simply based on that itself. And
there's a lot of good stuff for, this stress relief, like cat claw. You use cat claw's pretty good with, because I kept on hearing that over and over again, starting like especially females that are in like high stress jobs and stuff. Where you need the adrenal support. That helps with adrenal support.
Cat's claw is good for adrenal support, but it's really, really good for how can I explain it? Intracellular vitamin C levels. It also reduces inflammation due to rheumatism.
Okay.
So that's something I will give someone who may have like joint pains or may have just come out of some sort of a injury.
Okay. And if we're going traveling, if you're going traveling, what would you pack in your bag to take with you?
I always take a liver support.
Yeah.
Because usually when I'm out with my softball team, I'm not getting the best sleep.
Yeah.
And I usually carry something for immunity, maybe astragalus, simply because that's a simple root to carry, and it does a quick job of increasing immune response. Burdock root extract is another one.
Yeah.
Yeah, it's quick on the liver. So.
And what's your like daily routine? Like, do you have a daily routine or daily supplements that you take or herbs that you're?
Oh yeah, daily I drink liver support all the time.
Okay. Yeah.
Just even a little bit of anger can impact the liver negatively. So I definitely try to drink that often. Now when it comes to topical, I use our arnica cream that we make, which is we call it the Soothe Me cream. That one is really good for releasing like muscle tension, especially on the flight. I lather myself up in that stuff.
Oh, yeah.
And overall, those are like my go-to 4 items that I use.
Yeah. Yeah. Arnica we use quite a bit, especially, facelifts and rhinoplasties and just, any post-surgery, like inflammation and like bleeding.
Oh yeah.
Those are.
And bruising. And it's really good. Only people should take it internally if you get it from a doctor in the tiniest capsules because it's super potent when it comes to blood thinning.
Yeah. And so with arnica, you think it's better, for bruising and swelling. Is it better topically to the area that you've had surgery versus taking it orally or?
I think it's better topically when you place it directly over the region you've had the surgery once the wound's closed.
Yeah.
And even topically if you are simply having like normal muscle pains from like day to day.
Okay.
My aunt, she had both of her knees replaced last year, and her doctor told her she would be having bruising for like 2 weeks. It would go from 3 phases, and I'm like, no, it won't. She used the arnica cream, and she went from phase 1, and she was done with bruising in about 7 days.
Okay. Yeah, it does wonderful stuff, especially with the rhino. I usually combine it with like some red light therapy and stuff, and it usually helps out tremendously.
Red light therapy is amazing.
Yeah. So it's definitely made a big difference in like pain level too. Patients have a lot more pain when they're more swollen. Mm-hmm. That inflammatory process just lasts a lot longer. So it's
I could imagine.
Yeah. So any questions for me, like from
in your practice, I know you say that you are like focusing like on the holistic side and that you spend more time with your patients. Are you someone who would potentially carry plant-based supplements in your practice with regards to wellness?
We already like do some supplements, but like, we would do plant-based. And, like we do the arnica, we give patients like a care package preoperatively, which has some of the peptides, the Wolverine stack in there. We do have a liver cleanse. The liver cleanse is the Thorn liver cleanse, which, it does the job. I think it's like milk thistle. It has some acetylcysteine in there, so to produce their glutathione production. And then for especially the face and the rhinoplasties or the nose jobs, we're using bromelain, the arnica. It's like a combo of bromelain arnica to help reduce inflammation and swelling. So, I'm open to it. I have to, and I'd like to take more of a dive into it to learn more about like different things and how they function. I started to a little bit because we have a supplement that's already made, and I was doing this course on just like supplements, and I just didn't have the time to go through it because I was going through like all the vitamins and everything that you see in your multivitamins or in your supplement stash, whatever it is. And just going through the vitamins alone, I was like, oh man, I can't do it. It was taking a lot of time. So along with like busy surgical schedule.
imagine.
I definitely like learning about it, and like, you know, there's little tidbits that I'll dive in and like really take it in and learn more about it. Like just watching some of your like Instagram posts, you know, some of the social media stuff, it definitely helps out to just learn, at least give you a little tidbit, an opener to like what you want to do and learn more about it.
Yeah, you can also check out an easy way to get more information is the monographs at the EBSCOT.
Okay.
They have a lot of really good monographs where it just breaks down the full plant's entire system, where it was found, and it's quick and easy because someone else already did all the research for you.
Yeah.
They're like usually like 10 pages a plant, but it's really good detailed information.
Okay. Yeah. So, Rod, you want to come? This is my brother, Rod.
Hello, how are you?
How are you?
Nice to meet you. Fine, thank you.
Pretty much went through a lot of herbs and stuff. Yeah.
I was watching a lot of your posts today and yesterday too. A lot of interesting stuff. What are things you swear by that you take personally, or is it pretty much everything you cover? Your morning routine. You guys went over that.
We went over that. That was like my last question before. Yeah. We just talked about that. Yeah. No, it's all good.
That's what happens when you show up like 50 minutes late.
Yeah. How about for kids? Like anything that, you know, like especially for immunity and stuff, but like right now, like anything you have for kids or
catnip is really good for kids. I know it's
catnip.
Good for, yeah.
Oh, nice.
It's really good for kids, although it's good for cats too.
Yeah.
It is high immunity boosting. It also decreases the potential for bedwetting. It helps with focus again. Is really, really good for
bedwetting, huh?
Oh yeah. Yeah, it lowers the incidences of bedwetting the more you consume it. Help with night terrors if they normally have scary dreams or nightmares in the nighttime. Again, California poppy's safe for kids 2 and over.
Yeah.
And even elderberry or Sambucus nigra, that one is good for children. A lot of people know about the elderberries.
Yeah.
I don't like them. They smell like feet, but it's pretty good stuff. And you can only drink them or utilize it if it's already roasted.
Okay.
So kind of like marijuana.
That was actually going to come up. I was like, do you deal with any like CBD formulations or anything like that?
No, I don't currently. I will not carry CBD or THC in my location because it's considered high risk. With regards to its regulation, so I try to stay far away from that stuff.
Yeah.
But I can mimic if you want to experience that experience as if you are using those products. I can definitely mimic with other plants.
Okay. All right.
There's just a lot of downsides also with THC. So I'm sure if there's another natural, like mimicking type of formula.
Oh yeah, it's quite a few.
I took my fair share in my younger days, but I stopped because of all the anxiety and the like paranoia feeling that you get. But it's mostly, even if it's like the next day or something, it's just something you know what, I don't need to deal with this, so I'm gonna stop.
Was that like edibles or the flower?
Both.
Oh, yeah, I can't do edibles. It lasts too long in my system.
I
Like the
kind of
half-life
like that.
is like 48 hours.
Yeah.
It normally makes me nauseous. So.
Okay.
But a lot of times, if you want to do something outside of like, for example, THC, some people utilize mugwort, which is it's a spiritual herb, so it helps with like the third eye activation, if you will. And then Damiana is another one. That one is smoked by natives to assist with the with euphoria, interacting with their ancestral beings, if you will.
What was the first one you said?
Mugwort.
Mugwort.
Yeah, that one. You can drink them as teas too, and you get the same kind of experience. And then what's another one? I really don't go into those herbs.
Yeah, sounds like it.
Yeah, there
non-alcoholic.
will be a drink that will work really well. Especially if it's like you want something that's more of a downer. Skull cap, you drink a sip of that. At the moment it crosses the lips, you get the sedative effects from it.
Okay. And how about stuff to relax and just like take the stress level down?
Lemon balm is really good for relaxing. Passion flower is really good for relaxing. Kava is good for it, but that can become addictive.
Yeah.
So I try to steer
kava.
people away from it. Oat straw, sativa avena, that one is a super bomb for the central nervous system and overall nervous response. That one can be used as a for insomnia as well. Hops, Hopulus lupus, they kind of use that to make beer though.
Yeah.
So usually if a person is using like beer for anxiety, you can substitute the hops in place of the beer and it'll give them better liver response.
Okay. So any herbs that you suggest for hair loss?
Yeah, we do have a mix that we make at our shop that is called our Noodles Hair Elixir. It's a formulation of about 6 different herbs that work really well for hair loss with regards to fortifying the follicles, strengthening the hair, and also thickening it. One good herb that I will say out loud that is really beneficial for the hair is Irish moss. Okay. That specifically helps with strengthening hair follicles, and you notice an increase in the hair production within 2 weeks of use.
Okay. And is this like a serum you put on after you shower, or like how's it put on, or how do you use it?
I use it 2 weeks, starting 2 to 3 weeks after I get my hair done.
Okay.
And when my hair isn't done, I use it every week.
Okay.
Once or twice a week, depending on how often I go to the gym and sweat it off. But you don't have to use a lot of it. It's very conservative amount needed because once it penetrates the actual hair follicle or the scalp, then the plants do the rest of the work.
Okay.
So it's got a long lasting.
So it's made for men.
Oh yeah.
Because you only do twice a week.
Yes, it's made for men.
It makes it perfect for men.
Yeah. We've gotten. I had a lady who was dealing with traction alopecia.
Yeah.
Her top was pushed back, but we actually were able to fill in some of the spots that weren't completely damaged. Yeah. And then I think over time, as she continues to use it, we start seeing some more filling in.
I'd say traction alopecia, that's mostly stress and pull.
Yeah, stress and pull, someone keeping their hair in a ponytail too often, not allowing their hair to actually grow in its natural direction it's supposed to grow in. Those can cause the hair to start to break off.
Yeah, I got to get my wife. Like, my wife's not losing hair. She's got pretty thick hair, but she always thinks, she tells me, and I'm like, it doesn't look like it's going anywhere.
That sounds
like it's just plugging up the pipes. But
when I go bald, I'm just transplanting my chest hair on top of my head.
Do any of these have an effect? Do you think the hair serum stuff has an effect on DHT? That's why you're getting testosterone?
It could have an effect on DHT, maybe because some of the herbs do impact direct hormone imbalances. Yeah. And it does get absorbed into the bloodstream through the skin. So
okay. And if someone wants to get this, do they come to the shop? Can you buy it online?
Yeah, you can stop into both of our locations. We have one in Mesa and one in North Phoenix, Arizona. And we have a website, which is biobalancedorganics.com.
Okay. So that's like something that like I would definitely carry because like we have decent amount of population because we do PRP hair restoration and stuff. And even we get patients on peptides and stuff, and especially if it's, with the peptides and most of the other things you got to put on like daily, and people don't want to put, especially men, don't want to put that on daily. So if they're having to only do it 2 or 3 times a week, that's something that's like stuff. That's huge.
Yeah, and you can even eat it if you wanted to.
Oh yeah.
So
yeah, you get those questions all the time, even people you don't expect it from.
Yeah.
Like even like relatives, friends, acquaintances, always get texts about like, what should I do about my hair?
Hair is a big thing, everybody sees that. It's almost like teeth, right? The first thing a person sees either the face, the hair, or the teeth, and want it to be in good shape.
Yeah. Yeah, I don't know, like the new supplement we made, it's a formulation of a bunch of things, but like, I don't know, part of it, it is increasing libido and stuff. And like one of the pages was that it increased fertility, but for like a lot of men, they don't want to read that it increases fertility unless we're selling a fertility medication. So we kept it.
I need more kids.
Some men get scared when I mention reproductive health,
But
I could understand.
For me, I noticed like my hair like started growing like exponentially faster, and that's probably some of the herbs and everything we put in there.
Probably, again, they're anti-inflammatory.
Yeah.
If they're interacting with the liver and producing
Yeah.
glutathione, then you definitely can
Yeah,
get
like
healthier hair, healthier
yeah.
skin.
Yeah, we have NAC in there. We have glutathione. Then
Oh, yeah.
yeah,
You're giving
so-
the body all
And
the
you got to
stuff it
think
needs.
it's also helping circulation, and that circulation in the scalp helps
Yeah.
quite a bit with
Yeah,
Exactly.
hair growth.
maybe I should put it. I don't need to rub it in my head.
You're good.
My barber's like you get the thickest hair I've seen. So
Because I don't go to this
a good
barber.
yeah.
Any like for like the relaxation meditation, like is there any activities you like to mix and match with some of the supplement stuff or recommend?
For relaxation?
Mm-hmm.
I would say skull cap is a really good, that might be a little too strong.
Is that the cool cap? with
Skull cap.
Skull cap.
Scaleria. It's like
a
Chinese
mushroom,
skull
right?
cap. No, skull cap is actually a plant. It's
Is it a
a
plant?
Oh, okay.
Yeah.
Sorry,
Chinese
I was
plant.
way
It
off.
grows here in America too, but it is a sedative. So its job is to relax you, and as soon as you take it, you get a bit relaxed.
Yeah, I forget. One of the supplements I took had it in it. And I think one of the thorn supplements had it. I forget what. Because I took some of the sleeping stuff. But
Oh yeah, if it's for sleep, you probably find skull cap in
Yeah.
it. That or passion flower.
Okay.
Something that they are pretty much good for the central nervous system. Those are the stronger of the three of the herbs, though.
Yeah.
Those are the ones you would give someone who's like, oh, I can't sleep, I haven't slept for days, or I can't seem to get my mind to relax at all.
Yeah.
You want to give them something like
what
that.
else would you use for sleep?
Hops is a good one for sleep. Cali poppy is a good one for sleep. Those aren't as potent, but with the hops, once you are asleep, it helps you stay asleep longer.
Okay.
It doesn't necessarily put you into a sleep state, though.
Okay. So none of them help you into that.
Oh,
Put you
skull
more
cap
in a
does.
deep. But skull cap does.
Skull
deep
cap
sleep.
will put you into a very deep sleep.
Yeah.
Yes.
Do you get vivid dreams with that or night terrors?
I haven't
I'm
had
looking
anyone
for
say
vivid
it,
dreams.
but depending on if you're sensitive, you may get vivid dreams from it or night terrors. Mugwort will give you a really vivid dream.
Yeah. Okay.
Yeah.
Okay.
But it does the opposite in kids. What was it that you said for the kids to decrease bedwetting?
Oh, catnip.
Catnip.
Yeah, that one is also good for sleep too.
Okay.
So you compare those all together and put you like a really good.
With catnip, do you get any weird dreams or anything, or is that?
Again, it depends on the person if they're sensitive.
Yeah.
Depends on how their body responds to the state of being completely sleep. Because some people don't even go into REM, to be honest, or they get there and don't stay long enough to even gain a dream. So
Yeah.
it might give a person an interesting dream if they're not used to it.
Yeah, some people don't dream.
Yeah, a lot of people.
I thought it was like the weirdest thing. My wife's like, "Oh, I don't dream." I'm like, "What does that mean?"
I can go to sleep and wake up with a whole formula from a dream.
The thing is, I don't know, with the peptides. Once I took the growth hormone releasing peptides, I used to take black market stuff, which, then I started taking it from the compound pharmacy, and I had vivid dreams. But I feel like once I caught up with my deep sleep, they just went away.
Yeah, that's usually.
I don't know
how it
if
works.
it was me catching up with my sleep versus just me getting used to it. But anytime I am in sleep deprivation, I start to get the dreams back. But once I've caught up with sleep, it kind of everything goes away. I don't
Well, they
really
say
dream.
in psychology, if you don't get enough sleep, you do start going through psychosis a bit.
Yeah. Yeah, your brain doesn't clear out
Yeah.
everything.
And a lot of times people aren't getting sleep because they're not sleeping in dark rooms. You need pitch black darkness to get into some really good sleep.
Yeah.
And most people have a light on or a candle burning or something that's around them that even the slightest flicker is interacting with their
Or
circadian
even
rhythm.
if they were on a screen, 15 minutes before bed, like that's
Yes.
going to affect it. So it's going to be stimulating. Stop me if you guys went into this. How did you get into this?
We did go into it, but I can go into it. Well, anyways, when I was in Ohio, I had suffered from migraines and I was prescribed a lot of medications. Honestly, I got a spinal tap. I remember that like it was yesterday. I still got the scar from it.
Yeah.
And that threw me completely off because I was like, are they about to stick a needle in my back while I'm sitting
How old
here?
were you?
I Oh, good question. I think I was 22 years old at
Okay.
the time when they did that. And when the doctor just had me sitting there, and then I went in for my last endoscopy, I was like, yep, God, please help me figure something out. This is not going to work. And I haven't taken a single pharmaceutical medication since, I want to say like 2014.
Nice.
And I would never take another one.
Yeah. How,
Yeah, so
how
let-
often, sorry,
go
how
ahead.
often were you getting the migraine headaches?
Oh, I almost flunked out of my undergraduate studies. I was getting them daily to the point where I would take one of the Percocets. I would fall asleep wherever I was, wake up with a migraine. A lot. It was
And they
super
lasted
chronic.
like
Yeah.
hours at a time or never relieved.
If it was a relief, it would be when I was asleep.
Okay.
And when I wake up, it was no relief.
That's kind of dangerous. 'Cause
It was
then you're like
terrible.
just seeking sleep all the time.
Seeking sleep, seeking like, something to distract you from it. I wasn't even really nice to my friends either at the time. So it was impacting my personal life a lot.
Imagine it would.
So I wanted to go through some of the common medications people take and what we can substitute with an herb. Like let's say ibuprofen or Tylenol, and you talked about migraines. Like, what would you take instead of one of those? Because I'm like, I'll deal with the pain, and like, I'm like, it's going to be over like in a day or so, or even if I have joint pains and stuff, like, I'm like, I'll just, it'll subside. I don't want to take ibuprofen or Tylenol and mess up my system.
Cali Poppy is a good one that you can take because it does mimic like an opium.
Yeah.
When it comes to like Tylenol or ibuprofen, white willow bark or Salix alba, that is that's what they use to make aspirin.
Yeah.
So if you want to have a long-lasting relief, it may not impact as fast because it's not a beta blocker, but it will give you the relief for a longer time frame. With regards to like a headache or something like that, you want to try chrysanthemum or feverfew itself, which is chrysanthemum parathenium. That plant specifically sends circulation to the brain, and it reduces the onset of migraines as well as tension headaches.
Right. And do you think, we were talking about arnica before, do you think like if people are having tension headaches and they, like with the lotion, if they're putting that lotion in areas that the headache starts, do you think that helps with that?
We've gotten some relief right in the shop actually from people who were having tension in their shoulders and it was causing them to have cluster headaches in the back. They put it on, and since it pretty much provides instant relief with regards to blood flow, we've seen pretty quick results.
And the other ones, like we give a lot of muscle relaxants to most of our post-op patients, and like for me, like when I had back issues, I took like an herbal supplement. I forget what's in it. It was like 6-7 years ago. For muscle relaxation, it was the all natural muscle relaxation. Do you have something that helps with relaxing the muscles?
Oh yeah, we have a tea that we make that has really been good for people with fibromyalgia. Okay. Some of our Google reviews say they talk about it a lot. But the skullcap muscle relaxer. That's why I say that one's super sedative. Again, you can go with oat straw or whole oats tops. Those are also really good for relaxing the muscles, more so central nervous system, but that then relaxes the muscles in a way. Catnip's another one, Plash Flower. There's a plethora of...
I think we got to do a skull cap drink.
Oh, yeah, try the skull cap,
No, we got to do a drink. We got to just come out with a drink with skull cap.
Another one that would be good for it, that would be, what is it called? Valerian or Valeriano. Yeah. That plant is pretty cool, but it can give people anxiety if their bodies respond and interact with it in a weird...
Yeah. And then... I know we talked about anxiety. You have multiple. Is there any of them, like, I know on some of the reels and stuff you talk about smoking them versus teas. What are some things that are being smoked and being beneficial? Is it the anxiety stuff, or like what herbs are good to be smoked?
Pretty much most of the leaves people smoke.
Yeah.
Another one that is really good that people smoke that I get from overseas is Blue Lotus. Yeah. That flower is specifically made for someone who's experiencing anxiety. They want to pretty much relax their central nervous system, help them go into a more relaxed state. That's a good one.
Is that pretty strong?
Yeah, pretty strong. Yeah, you only need a little bit of it.
Yeah.
Mugwort is another one that we already mentioned a bit about relaxing with regards to utilizing as a tea or smoking it. St. John's wort is cool, but it causes photosensitivity, so I try to avoid it.
Yeah.
Especially living in Arizona, you don't want to get sunburn.
Yeah.
So those are quite a few.
And how about for skin health and stuff? What do you prescribe for that?
Chickweed is a good one for skin health.
Yeah.
You can try red clover. That one helps with psoriasis. Lavender is really good for eczema. Marshmallow, slippery elm, those provide moisture to the skin. Aceclorola helps to lock in moisture. It's a lot.
Do you make any creams and lotions with your herbs that you have for skincare?
Oh yeah, we have one that we call our Skin Rejuvenate, which doubles as a sun protectant.
Yeah.
It uses red raspberry leaf and seed in it, which acts as a natural SPF.
Yeah.
And that one is the one that myself and a lot of my friends and most of my clients use throughout the summer when we go float the river, since it's non-toxic. And it also provides a lot of relief from the UVs.
And is that just lotion, spray, or?
It's a lotion. It's a topical that you would use, and it's infused with those plants.
Okay. And then how about dandruff? Anything good for dandruff?
Seborrheic
I know
dermatitis.
I know it's usually caused by a lot of different
personal
things,
question.
Yeah.
Ask him for a friend.
Asking for a friend.
With dandruff, you could do a hair rinse using rosemary.
Yeah.
That would clear dandruff pretty quickly. You can also try a hair rinse using, again, a slippery elm, because that'll help to provide more moisture to the scalp and the follicles. You can consume internally. Nettle is good for it.
Yeah.
Chickweed is also, again, good for it. Yeah. Pretty much anything that helps with the liver.
Okay. And anything antibacterial?
Olive leaf is antibacterial. That one kills virtually any virus or bacteria on the skin internally.
Yeah.
It's just a pop quiz. It's just like you answer it. It's like, how about this?
Yeah.
How about that? How about that?
Yeah.
Well, we're going through common things that.
Yeah. I hope people are taking notes.
I don't want to take medications for it.
Yeah, definitely.
I don't want to actually take antibiotics and mess up my microbiome.
Right.
Or even for like dandruff. You've used every shampoo and it doesn't work.
Fennel is another good one that's antibacterial. Pau d'arco is antifungal and bacterial, so it kills candida as well.
Yeah.
Olive, oregano.
Wait, which kills
Pau d'arco.
What's it?
Pau d'arco. PAU space D apostrophe ARCO.
That's applied topically or eaten or both?
Both. Mm-hmm.
Okay. Because a lot of people say a bunch of seborrheic dermatitis is from like candida or fungal causes.
Yeah.
So, like, I know our other brother has a lot of improvement with like fluconazole, which is an antifungal drug, but it does a lot. It does a lot of
pretty
damage.
much everything in the system. And we all need bacteria. Like as humans, bacteria literally lives on our skin and our digestive tract, and every crevice of our body to fight off bad things. So if you're taking something that kills all the bacteria,
it's a balance.
Yeah, and part of, like we deal with breast implant illness and people are like, oh, they found mold in my breast pocket. But, like we have all these bacteria and like even the mold they talk about is probably candida or something that is on a lot of patients' skin and like in that breast pocket. They're not finding it like right away. They're doing PCR with PCR, you're going to find like anything. It's like
super sterile.
Yeah.
A lot of times people aren't like drying completely in those areas either. So moisture, and then it's usually dark and hot. Yeah. So then you're building up the bacteria naturally.
Yeah. Mm-hmm. So getting more into your shop, how's it set up? Like, do you have pre-formulated mixes, or do you like choose kind of what you want, or ask like what you should get?
So we do have pre-formulated mixes, and those are given to people who aren't having many contraindications or who aren't taking like a high level of medications. And then I have some that I have to formulate specifically for people based on those particular reasons. And then we have over 200 herbs. We have a lobby that people come hang out, do homework, watch TV. we carry pretty much a lot of our backstock at our main headquarters in North Phoenix, and then our Mesa location is set up as like a wellness spa. Yeah. So we have a sound bowl, sound bowl or tubation sound bowl, if you will, room in there.
Another one.
We also have what we call.
This is 3 in a row.
I love it.
Yeah,
I love the sound meditation.
Yeah, me
it's
too.
So nice.
Oh, I put it on for the kids, and then I'm passed out.
Yeah,
right.
Yeah.
And then we have a yoni steam, or we call it our herbal steam studio, where you sit on a throne and you get the essential oils of the plants steamed up to the private areas for both men and women. It's really good for inflammation.
What are some of the essential oils you're using for that?
Oh, they're not actually essential oils. They're the essential oils from the plants themselves. So we take the plant, mix it, and place it into the steam bowls for it to steam up. And we also have an esthetician at that location and a classroom, because we'll be teaching herb classes, giving like a little bit more detail to individuals who want to go in a route more of a holistic direction, so that they can go about it properly, instead of just Googling, as you were talking about earlier, and not really knowing what plant does what and causing potential damage.
Yeah.
So most of the formulations that you have to make, you can, like, how long does it take? Like, somebody comes in and says, I want this, and you like decide, like, this is what's going to work for you. Like, let's say at the North Phoenix location, do you do it while they're there?
Oh yeah, I can do it right there, because usually when I'm asking questions, my brain's already like, oh, I think I could do this, and this. And then it picks the best options for them.
Do you even think, or does your arm start reaching in different directions?
Sometimes it just reaches, and I'm like, why would I pick? Okay, this makes sense. And then I'll go from there. Or sometimes I have a lot of clientele who call me from different states. I have a lot of people in Omaha, Nebraska, and they'll call with what they have going on, and I can formulate it while I'm over the phone with them. Yeah. And get it mailed out to them quickly.
Oh, nice.
Yeah, and some people just order our normal blends that we have online once they read about them and they know what they have in them. I have a lot of local people, Santan Valley, that order directly from our website. Yeah,
Santan Valley is local, but it's far away.
Far away, but local. Yeah. Santan. But I also have a lot of clients that drive very far to come see me as well. Yuma, I didn't even know Yuma existed until last year, when a guy and his wife, they come back every 3 months just to like restock, just because. Yeah.
Yuma's pretty fun.
Do you get any wild stories? Because you must have people that like just did their Google search, started taking some herbs, and then they're like, all right, I had like diarrhea for like 3 weeks. Like it might be time to go and see like why I have it so bad.
Yeah, I've gotten a lot of stories of people just Googling stuff and they're taking it. Oh, I saw that this worked. I'm like, and they're like, well, but my heart has been having palpitations. I'm like, well, did you not read the fact that overdosage can cause heart palpitations? But a lot of stuff that you find online, it doesn't list the implications of the herb. It just gives you the benefits of it. Yeah. And for me, that's a disservice to the people that's looking to utilize them, because you could tell somebody what's good for them, but then you also need to let them know what the possible outcome could be if it's opposite.
Yeah. Yeah, even AI, like it kind of gets better, but it's still like it almost.
I think it depends on the user.
Scary. Yeah.
If a person knows how to research, and you can teach AI how to pull up the proper articles for you on proper research platforms, then it could be a really good tool. But if you're just asking it questions and going off of what it's telling you, then
it's the individual,
you don't know where it's getting that detail.
Yeah, you got to just like start out with one thing and then
tell it how you want it to do it.
Yeah.
Bring me a specific article for this. Yeah. And give me 10 different articles from all authoritative sites. And it can do that for you. Yeah. You just have to know how to ask it.
Yeah.
So your locations again, you want to give that out, and your Instagram tags?
Well, we have our North Phoenix location, which is 13041 North 35th Avenue in Phoenix, Arizona. And then our Mesa location is 701 West Southern Avenue, Suite 201, right down the street from MCC. And our website is www.biobalancedorganics.com.
Awesome. There's a lot of info. Just the short time I've been here, I'm like, oh my God.
I think that hair serum's definitely going to crush it.
Oh yeah, it's really good stuff.
So what's one of the herbs that you could use to be age-proof?
I would go with red clover, Trifolium praetens. Okay. That one's really good for the liver. It helps with skin. It literally assists the body's natural protocols with blood cleansing. So.
Yeah. Yeah, and what people don't know is like if they clean out their liver, their skin looks so much better.
And your hair.
And yeah, and like that's like how you can tell overall health. That's why like real bad alcoholics have the rhinophyma, or their nose is like beet red and looks horrible.
Yeah, or they have like the butterfly, like they have lupus.
Butterfly. Yeah.
Is mine that bad right now?
No,
You need to shave down the rhinophyma.